A very good evening to one and all. I welcome all of you for today's evening webinar, which is conducted by Assam State. Myself, Dr. Neha Singh from IAP Technical Team. I welcome you all of you for today's webinar topic, that is sports physiotherapy and its live sessions. I would request all our viewers to subscribe to our YouTube channel, to view our webinars and follow us on Facebook to receive regular updates. We are streaming live for today's webinar. Now, I would like to welcome our today's moderator, Dr. Lopadas ma'am and Dr. Urvashi. So I hand over to Dr. Lopadas ma'am for continuing today's session. Over to you, ma'am.
Thank you. First of all, I welcome everyone for the webinar today. And I'll just give a brief introduction about Dr. Neha Karnik. So she's a sports physiotherapist, and she's mainly she's a strength and conditioning coach for athletes. And former, she was a national physiotherapist for women cricket team, Indian cricket team, and also for Sri Lankan women cricket team. And presently, she is a founder of exercise and rehabs, the strength training and rehabs. So apart from her physiotherapy degree, she has been also trained about manual concepts on advanced sports concepts from Perth, Australia. And she's a BCCI level 1 accredited sports physiotherapist for cricket, and also accredited level 2 coach and mentor for sports physios and sports athletes from Australian Strength and Conditioning Association. So we welcome Dr. Neha for the webinar today, from which we are organizing from Kamrup branch, Assam State IP Women's Cell. And I welcome all the participants for the webinar today. So hope we'll have an brainstorming session. And now I would like to hand over the session to Dr. Neha. You can continue.
Thank you, Lopa ma'am. It's also good to see you after many years. Guys, just to let you know, me and Lopa ma'am, we studied in the same college many years back. So thanks to IAP for reconnecting us through this webinar today.
Yes.
So incidentally, I have also worked for Assam State Cricket Association, and I definitely miss Assam for all the beauty, the Northeast that has the beauty that they have to offer. So what we will be talking today is sports physiotherapy and its life lessons. Quite often we do hear a lot of things physios talk about, protocols hai, ye hai, wo hai. There are a lot of things. So let's talk of things that we take back as physios from what we do, what we work. Okay, because we educate our clients every now and then, we educate our athletes, we work for them. There are a lot of things that your patients might tell you, oh, I learned this from my physio. Okay, so today we are going to discuss what a physio has learned after spending about last 11-12 years in sports. Okay, so I'll start with a very small presentation. Yeah, I'll just start it here. Okay, so the sports physio. Just to give you a brief, I'm basically a sports physio, and I have my own setup called Exercise, sports rehabs and athletic training. What we do is, apart from rehabilitating injuries of sports persons and even those non-sporting people, we also train them to get back to sport, because there's a huge gap between getting somebody just pain-free and being able to go out and perform. So we are bridging the gap between a rehab and a full blown performance in terms of strength, speed, and power. So I'm a level 2 coach for the Australian Strength and Conditioning Association. We also do mentorship programs for young physios, intern physios, who want to make their, who are looking for to making their careers in sports, and even to the young strength and conditioning coaches. I was fortunate enough to be part of BCCI from 2009 until 18. and I've been fortunate enough to be part of 4 World Cups. So the good thing about sports is it takes you to places, most people know. But today we are going to discuss something very different, right? So I have some fond memories which I have in this PPT. This is a picture back from England in 2014. We won first test match against England in England. We beat England on Independence Day in 2014. And this is we played our first test match after 8 long years. And out of 15 players, only 3 had played test match before. So we were essentially with a young crop with no experience of test match. And it's such a nice feeling to be out there, beating England in England. So next is this is also from the Lord's balcony. Every physio who is in cricket, their dream destination. And currently, I'm working with an Olympic athlete. She's a wrestler, and she's already secured her berth in the Olympics. So yes, there's a complete shift in the terms of technicality of sports. It's a completely different sport we are looking into. So I will just briefly describe what actually a sports physio does. And there are different roles that a sports physio does, and hence you learn a lot of things from these various different aspects of sports physiotherapy, because it's beyond just rehabs. There is most people ask me, for them, most young physios, they believe sports physio is everything is on the field. Well, there are two different kinds of sports physios. One who is on the field and travels with the athletes, with the teams or with an individual athlete, and the other one is off the field. So off the field is mostly like your clinical setup or your academy setup, like an institute of sports, a college, a performance center, that sort of thing. Okay. So on-field physio is the one who travels. Off-the-field physio basically has a 9 to 5 job sort of thing, but then they have more access to the players and they have longer time access to the players. So both have their both have their pros and cons, and both give you different kinds of life lessons. Okay. The on-field physio. So on-field physio, what they do is they take care of injuries that happen during during the match, during the tour that happens. And it's not just injuries, it is other health related issues as well. As a physio, we are the first point of contact for most medical emergencies. Quite often, physio is the only medical paramedical person with the team that travels, and they usually have a backup at home country or hometown with a physician or a sports physician, because most physicians do not travel, the physios travel, right? So they take care of on-field injuries and accidents. uh, they also, most important part is there are a lot of injuries that happen which are not bigger in the intensity. They are not big injuries to be seen outside, but they definitely have impact on the performance. For example, if there is a bowler who fields back in the deep, maybe around the boundary line, and comes to you somewhere in the water break and says, "You know what, physio, my shoulder hurts. I can bowl, but I can't throw. I still have 4 more overs to go. Can you do something about it?" Now, here we are looking at pain that is impacting one part of the whole sport, one action of the sport, but not the other. So this is the time when the physio has to diagnose, take a quick decision whether this athlete should play or not. Yes, if they play, what are the things that we are risking? What we can do best for our athlete to stay in the team, to play, perform, as well as make sure that the athlete does not aggravate the injury. Okay, what if it's World Cup final? So yes, we will be in that kind of situation. Then there is dope testing that happens on field. It happens off the field as well. So physio has to have knowledge about World Anti-Doping Agency, your prohibited substance, how they affect performance, which are to be given, which are not to be given. We need to have updated knowledge. Okay. That is one thing. Hydration of your team or your athlete, and you got to be ready for any emergency situation. It can be as weird as having an anaphylactic shock. It can be as crazy as having an anxiety or a panic attack by an athlete attack. For athletes who, sometimes they're so anxious, they're making a comeback, or maybe they are young athletes, it's their first match, they must be very anxious. So all these things happen. So a physio has to honestly fill in lot of different roles. Okay, and these filling into different roles, we learn lots from the situations and from the sport. Another place to learn a lot of things is your team meeting. How team meeting happens, what are the different thought process, how can we make it better, how to become mentally tough in situations. So these are the things that we are going to discuss today. Off the field physio, they are mainly into an academy setup. The best thing is they're able to monitor athletes. Like you have these physios see athletes that are usually in rehab and are currently ruled out of active sport. That means they won't be playing matches for a while till they get fit and fine. Okay, these physios can have their timely screenings done. They can see their athletes on regular basis. Let's say, okay, let me have a daily screening. Let me have a look at your hamstring length every other day. Let me have a look at your rotator cuff mobility. Let me have a look at your shoulder mobility, how that works. So this is what the off the field physio does. These are long term rehabs. Maybe they can be short as well as long, of course, but most athletes with stress fractures, stress reactions, chronic tendinopathies usually are in a long term rehab, and they go to a academy setup. Now there they can have their training done within the constraints of their injury. What can be permitted, what is not permitted, how we can sit together with the coach, SNC coach, and get the athlete back to the sport. Okay. Sometimes when your rehab is in advanced stages, you want the athlete to go back to running. Suppose they had an ACL reconstruction done, and they decide, okay, fine, now I'm up to the mark. I'm able to do most of my stuff. I'm going up and down stairs. I'm walking. I'm cycling. Now it's time to go for a short run or begin running. So getting them back to running, back to throwing, back to bowling, back to hitting, batting, whatever, getting back to that technical aspect is one thing that can be done mainly in an off the field setup, after a long term rehab. And best thing is they can, have a night, they can have their time in the academy setup. There are a lot of people around you. Off the field, on the field physio are usually working alone, but they definitely have a backup back at home, a team of physios who help them out. So this is where our presentation begins. What being a sports physio taught me? It definitely taught me lots of patience. Lots of patience for the reason that different tissues, whether it's your tendon, ligament, bone, muscle, soft tissue, fascia, various different things take different times to recover. Okay. Now, recovery can be dependent on the kind of pathology, pathomechanics, the training history of an athlete, age of an athlete, other issues, other medical issues of an athlete. There can be lots of things. So when we read in books or literature, ideally this X kind of injury requires about 3 weeks to recover. Some athletes may really take longer time, and they would ask, "Arey, ye to 3 weeks mein ho jata hai. Why am I still not up to the mark?" So yes, keeping lots of patience and working towards our goal is definitely something that sports has taught me. Apart from professional sports that I've been part of, I also see a lot of recreational athletes, like triathletes, runners. We see lots of marathon runners, and most of these runners are in the age group of 30 and above. Okay, so when as we grow older and wiser, we there are definitely physiological changes that takes place in our body. Maybe it heals slower than what a 20-year-old would heal. They have different challenges in terms of recovery, which is a very important tool in coming back from an injury, in recovering from an injury, what kind of recovery we are doing. So, having patience dealing with athletes who also have a professional life and possibly cannot dedicate the amount of time for rehab as compared to as much as a professional athlete would, it it makes you understand that things are going to take time. Okay, and that's why we need lots of patience with some of the athletes. um, Second thing, importance of timely diagnosis. Suppose we are with a team and we are on a knockout stage. Okay, if we win the next match, we are going to go ahead. If we lose the next match, we are out of this tournament. Okay, so at such scenarios, it's very important that we are able to diagnose the injury early on and do not wait for the injury to aggravate for a very long period of time. Okay, it may initially start with niggle, but eventually, what if it becomes a full blown injury where the athlete would will have to be pulled out of a tournament? Okay, um, timelines in diagnosis, especially of stress fractures, is very important. Sometimes you can pick up stress fractures, stress reactions very early on, depending upon how the athlete presents to you clinically, how their general health status is, what their loading is, how much their workload is, how they are able to recover, what are the recovery modalities. Yes. So, timely diagnosis in clinical setup, timely diagnosis definitely one of the most important things in sports. Because when you start diagnose, when you pick up an injury early, you start with a more targeted rehab plan. So we are fixed in our brains. Okay, fine, we know, essentially we have established, confirmed this is the diagnosis. Let's work more tailor made program than a generalized program. Okay, again, importance of correct diagnosis. Okay, so in when it comes to diagnosis, provincial diagnosis, final diagnosis, there are a lot of overlapping that happens. We cannot box injuries into this is only rotator cuff, okay, or this is only shoulder injury, this is only frozen shoulder. No, there can be coexistence of different things, and that can give rise to an injury. Or there can be biomechanical alterations, there can be muscular imbalances, there can be load related injuries, as we discussed, there can be overuse injuries, there can be a lot of things. So once correct diagnosis is when you come to a correct diagnosis, it is also important to understand the pathomechanics behind it. Okay, why the injury has happened in first place. So this is something that is very, very important, because if we do not establish the mechanism of injury, okay, this can happen especially in chronic injuries or overuse injuries. The athlete or the patient may not have a history of direct trauma, but something that has built up over a period of time. Hence, it's very important to correctly diagnose it and establish the uh, mechanism of the injury to help us correct it, address it, and get the athlete back on time. Okay. Assessment in details. I'll share a very funny incident, but it has a lasted impact on me. Back in 2010, I was in a national camp as an intern physio, and my senior physio asked me to show him what I did during the daytime. You know, like what lessons I've done and how how I'm going about with the rehab. So I showed him my notes, subjective, objective, SOAP notes, basically assessment and plan. He pointed out, you have not done amount of, or you have not done XYZ assessment. And I was like, no, sir, I've actually done it. He's like, no, you haven't mentioned, you haven't done it. And I was like, no, I'm positive I've done it, but because they were negative, I did not document it. He's like, that's where you're wrong. Even when the test is negative, you got to document it. I was like, okay. I quite did not understand it then. Then he explained it to me. What if I go somewhere where I'm unable to attend my athlete, or I have to go on a camp and the athlete had to be seen by a different physio, and you show them the clinical notes, the physio gets the clinical notes. When you do not write certain negative test or negative findings, the it gives them an impression that these tests were not done. So we are missing out on big area, a big chunk of area where there could be different injuries or different tissues that could have been involved. So in decision making, it was very important to even document a negative test. So, and we can, when we document positives, negatives, everything, there was one very nice thing he also told us, that put in your thought process of pathomechanics. So you will always remember why you came to a particular provisional diagnosis. What did you make out of it? What was your assessment in your mind? Okay, that you came to a particular diagnosis. So you can always retrospectively look back at the case and think about it. What changes I could have done to make it better? Did I miss out on something? So yes, this has definitely taught me, sports physio has taught me to document positives, negatives, everything, and even my thought process into my assessment sheet. As another thing, assessment in details, every small detail, no matter how stupid it may seem sometimes, but it's very important. It would be great, sometimes it serves as a key point. Oh shit, how come I miss it? Okay, I missed this. And then when you look back, you can see these small little key points which help you uh, understand the situation better. Next was clinical reasoning. So we are going to have life lessons in terms of sports and non-sports. So physio and non-physio. So this is what I learned from sports. Clinical reasoning. Quite often we get hooked onto protocols. Yes, protocols exist. They make a skeletal structure which guides the physios of how to go about a situation or how to go about rehabilitating a particular injury. However, we also have to back it up with a correct clinical reasoning. Why have I given this treatment? Why have I included an eccentric exercise? What am I achieving out of an eccentric exercise? For example, we are looking at patellar tendinopathy, and we want to give eccentric exercises to the athlete. So ask yourself questions. How is this eccentric exercise going to help my athlete? What effect does it have on pain? What effect does it have on the muscle? What if the muscle is in an inflammatory, what if the tendon is in an inflammatory stage, it's acute inflammation? Is it the right exercise that I'm giving? What is the rationale behind our treatment protocols? Why am I giving a PA glide only? Why am I giving a lateral glide only? Why am I gliding towards the pain or away from pain? So small things like these, ask yourself questions so that we learn more out of the same things that we might have done in the past, and we may see a different view towards it. It may just it may just click in your mind, oh yes, I've missed this in the past, this is how it works. um Funny story, I realized what a biceps load test is way much later. Later on, few years later, after I started assessing shoulders. So yes, we all fail somewhere, but we have to learn out of it. Things are going to happen. So yes, clinical reasoning and understanding things is very important. So do not fear failure. Go back at practicing as much as we can. Being a sports physio also teaches you lateral thinking. Okay, so for example, you're sitting out there on the field, your team is playing a match, and suddenly somebody calls for the physio. You don't see somebody falling there or whatever, you don't see any impact or trauma or anything, but they just start screaming for physio and you're running to the field. So now, for cricket, from the boundary to the wicket is approximately 55-60 yards, and you're running 55-60 yards, but at the same time we are also thinking, what if my athlete has fainted? What if they've been hurt by a ball? What if they had a seizure? Things like that run in your mind. So we have a lateral thinking process that keeps going in the mind to see what the situation is if the athlete has twisted his or her ankle, you start thinking, Should I take him out? Will he be okay on the will he be okay going back to his sport? uh, what if they are able to run and walk but they are not able to jump? What if they're absolutely not able to walk? So these are the thinking process that starts in your mind even before you actually reach the spot. You learn to make quick decisions, you learn to take quick decisions. We learn not to panic in situations when others do. As a medical personnel on the field, we cannot afford to panic. We have to keep everybody uh, calm so that the situation is under control. So yes, there is a lot of lateral thinking that we develop as physios who are working in a situation where you can face any emergency. Okay, of course lots of life lessons, that's where we are going to come back to. And there's lots of hard work. I've seen cricketers as young as 5 and 6 year old, as old as 40-year-old, and struggling cricketers as well, struggling athletes in different kinds of sport. um, they say it takes about 10 years for a skill to develop. So imagine the cricketer who has to play good level of cricket in a country like India, where there are lots of players. There's very big, tough, solid competition. You have to prove your mettle. You have to prove that you're physically and mentally strong. You can play a match. And trust me, this is like a public viva. Okay, we have faced viva in front of only our professors and examiners. These kids have a public examination in front of all the crowd, their parents, other athletes, coaches, lot of different people, selectors. So they start becoming confident at very young age. They start owning their decisions at very young age. Even if they do not perform very well in a match, they learn to take failures, they learn to take it gracefully. They learn, even when they win, they learn to win gracefully. Yes, winning is always great, but not everybody wins because there can be only one winner, right? So the preparation to go through all this hard work, the discipline that comes with sports, is something that I have seen mostly in athletes, in very young athletes. So that is something that I lacked as a kid, and now that I see my athletes being so disciplined, I think there's lots that I can learn from them. Persistence, a very very important aspect. We see a lot of athletes, if they don't get selected in one tournament, they'll still work hard, they'll try for the second, third, fourth. They will keep trying for years and years. If you've seen the Olympic history, we have athletes who have failed for 3 Olympics, they're on the verge of giving fourth Olympic is where they win the medals. There have been a lot of cyclists like that. And guys, four Olympics mean 16 years of persistence and training years before that. So yes, just like athletes, we need to be persistent in our efforts towards learning more, becoming a better physio, a better clinician, becoming a better team person, and developing our skill. Sometimes, a lot of times, we do face a roadblock when we are doing rehabs. You know what, I'm trying so much, but somehow that pain is still there. My athlete is not up to the mark. They are pain free, but the pain comes back once they start pushing in pushing in efforts or trying to throw really hard or sprint really hard. So yes, there are roadblocks that we face as physios, but being persistent in terms of hard work, reading through research articles, reassessing your athlete, will give you good results. Failure is a teacher. As I said, I have failed numerous times, but you learn out of it. For many years, I was doing few clinical tests in a wrong way, which I did not. Nobody pointed out, and I thought it's correct. Till someday I realized there's something wrong happening. How come I'm getting a negative and other person is getting a positive test? So yes, failures teach you, and you have to learn from it. Do not be afraid of failing in exams. Do not be afraid of failing in your assessments. Be persistent, keep working hard. Okay, so coming to non physio, non clinical things that I learned from sports. Something very interesting that I've learned, and I keep telling this to my athletes, most people who see me in the clinic. uh, sports has taught me how what control we have over a situation. Okay, so for example, cricket match hai, okay, and what is in our control? uh, we have our performance in our control, hard work is in our control, sticking to the game plan is in our control. Okay, doing a good quality warm up and cool down is in our control. Okay, and executing our skills is our control. What is out of our control? The weather conditions, who wins the toss, who loses the toss, and the final outcome of the match. Okay, outcome of the match is dependent on both the teams. Okay, so even in our physio life, we will come across situations that are beyond our control and in our control. In our control is how we assess the patient. If we are not satisfied with the assessment, let's do it again. Okay, our assessments are in our control, our thought process is in our control, how we design a rehab program is in our control, how we execute it is in our control. Most importantly, we have to educate our clients, we have to educate our athletes, okay, regarding the situation, regarding the injury. That is in our control. Okay, what is not in our control? MRI was not clear, X-ray was not clear, that athlete did not listen to me. They had a match to play, so the athlete was forced to play a match with an injury. Yes, so these are uncontrollables. The athlete injured again, they had an accident, or they did not follow my instructions. So few things are out of our control. So we should stop thinking much about those scenarios until and unless we can do something that changes it for good to get a better outcome. We should control the controllables, our hard work, our persistence, our exercise plan, how persistent we are in terms of our efforts. Secondly, to adapt to a situation, right? Now we will be in situations where we may not have everything that a sports physio needs on the field. We may not have nice fancy looking tapes, we may not even have a physio table, we may sometimes be in a situation where there is no physio room. Still, you got to assess your athlete. How do we do that? Okay, so adapting ourselves to use our manual therapy skills, our clinical reasoning skills to treat our athlete in the most adverse condition is something that I have learned from sports. So when I started my first job, there was no physio table, physio room, no tapes, no needles, no kinesio tapes, nothing. I only had therabands and a dynaplast. And I used to learn, like trial and error, how to do things. And that is how you become better. So we learn to work in lesser resources so that we value what we have later on. KT taping became more famous and popular much later. When I started as a physio, a sports physio, there was honestly nothing much. There used to be dynaplast and few tapes here and there. That's it, and rigid tapes, of course. But now I work with almost 11 different types of tapes. But that is evolution. That is we adapt to different things. If you have a KT tape, well and good. What if I don't have a KT tape? My treatment shouldn't stop there. I should look at different options to get similar results from different tools, from different techniques, from different exercises, from different modalities that we as a physio can can use. Team spirit. Now we are in our clinic, we are a team of physios. I have my physios with me, and we always work as a team. In sports, no match, no team game is won by an individual athlete. It's always a team effort. You're always in cricket, you will always need a wicket keeper, a bowler, a batsman, a fielder. Without, otherwise you would not really you won't be able to win a match. But at the same time, our team is also beyond physiotherapy. Our teammates are radiologists with whom we can have a brutally honest conversation with, or we can learn a lot from them. It's a team outside your core team. We can be brutally honest. We can have clinical discussions with orthopedic doctors. I'm lucky to have amazing orthopedic doctors and sports radiologists with whom I can have a clinical discussion with. In my clinical assessment, I think this is how it is. What is your opinion on it? So we work as a team, the orthopedician, the sports physio, the athlete, the coach, because the coach can give you a lot of insights on the technical part of the sport. The radiologist can teach you a lot of things, ki I can see something, but I don't know if it correlates to what your clinical assessment is. You can talk to the athlete, you can talk to the strength and conditioning coach. They can give you a lot of insights on their performance in terms of strength, power, agility, and a lot of things. So it's always a team spirit. You got to have your team together. Okay, individuality within the team. As a team, one is a athlete, the other is a strength and conditioning coach, one is a coach, other is a manager, then you are a physio. So we all come with our core expertise, and I think we should use it in the best possible way for the betterment of our athlete. And also we learn a lot. There's lots to learn from the athletes, there's lots to learn from your coaches, there's lots to learn even from your video analysts. They'll show you the videos of your athletes in different angles. They'll show you a lot of things that help you assess and work with your athletes much better. Okay, learn from the past experiences. Most of the athletes have video footage of their opponents. They do their homework just like how we do our homework, of reading research articles. Athletes look at videos of other athletes, how they are, what are their strong points, what are their weak points, like that. We should also have our SWOT analysis, right, from our past experiences, where we should be brutally honest with ourselves. What are my strong points and where am I weak? Am I weak in cervical spine? So let me work on it. Let me take next few months to work on cervical spine or areas that I struggle with, so that we become better each day. Sports has also taught me management of time. You got to be quick, you got to be efficient. And definitely in sports, 8 a.m means actually 7:50. That is something that I learned really really later on in sports. But yes, it taught me the value of time and time management. We cannot take long time to assess our athletes. You need to be quick, you need to be spot on, you need to be on your toes. Even when you are you learn to multitask, you learn to tape. Sometimes you learn to teach people. I had taught my athletes how to tape fingers. So I would pre-cut all the small tapes for my athletes for the next day, so they know where the tapes were, and they would put it on their fingers and wrist. But yes, bigger taping like shoulders, elbows, ankles, knees, I would do it before the team actually left. So that would be around 6:30 a.m in the morning. uh Resourcefulness, yes. When we enter sports, we bring in our expertise to the team. Okay, and every team member, I believe, has to be resourceful. uh Resourceful. If we cannot be anything, we got to be the most positive person, we got to be the most encouraging person on the team. Sometimes within the team, not just sports, but within your physio team, we may face ups and downs. We may have more patients, somebody may have less patients, somebody may not have very pleasant experience with rehabilitation of certain kind of injuries. We all have that, so we need to be resourceful. And the most important thing is we need to be resourceful for our team members, for our physios, where you can pool in knowledge, so you can be better, resourceful in terms of your clinical reasoning, your discussions. Be a mentor to somebody. If you have a junior physio who's coming in, you look for a senior physio who can be a mentor, because when you share knowledge, it only increases. But when we do not choose to share knowledge and we plan to keep it only to ourselves, we do not grow. So be resourceful, share as much as knowledge as you can, be open to new ideas, be open to new knowledge, be like a sponge, that can absorb all the knowledge that you can, but also that light which radiates energy and knowledge to those who are needy. Because we will always be in a situation where we will have younger physios who come in into our profession, and they look forward to you as a senior physio, as somebody they admire for their work ethics, for their practice, for their speciality, for their technical knowledge. So be resourceful to your junior physios, and be like a sponge when it comes to absorbing knowledge. So these are the few things that I learned as being from the team, like being part of the team. Gosh, it's already been 40 minutes. Lopa ma'am, should we go ahead with questions?
Yeah. If anybody wants to ask any questions, they can.
You have explained so well. All the doubts of the participants are already cleared.
I think it's all about learning. I have realized one thing, that get a mentor for yourself, or somebody. A mentor can be your friend, um, or your teacher, or your senior physio, or somebody with whom you can have a brutally honest conversation with.
I think she explained very well. I think nobody is having any doubt, I guess.
So I think you can conclude. So I would like to take the privilege of doing the vote of thanks on behalf of Kamrup branch to our resource person, Dr. Neha Karnik, for sharing her valuable knowledge and time with us. It was really very informative, ma'am.
Thank you.
And I would also like to extend my sincere gratitude towards Dr. Rushi Varshni, the national head of IAPWC, Dr. Reena Srivastav, our zonal head, and Dr. Pallavi Goswami, the state coordinator of Assam branch, for their enormous cooperation. I would also like to mention my special thanks to the IAP technical team who worked behind the scene to make this event a great success. I'm immensely thankful to my colleague, Dr. Lopa Das and Dr. Twis Lahon, for their involvement and willingness in conducting this webinar. Last but not the least, I would like to thank all the participants without whom this webinar would not be a success. Thank you, everyone.
Thank you. Thank you so much.
Thank you.
Thanks a lot, Dr. Neha Karnik ma'am and Assam team for this wonderful webinar to give the insight about the sports physiotherapy. And I think you have told very much clearly about the practical things and how we have to learn on field or outside the field. Thanks for this webinar, and I just shows my gratitude towards Dr. Sanjeev K. Jha, IIP President, and Dr. Ruchi Vaishnav ma'am, IIP Women's National Head, for providing us this wonderful platform for sharing the knowledge. And I just request everyone, please subscribe IIP India YouTube channel. And what about your feedback about this webinar? You can tweet on our Twitter account, IIP India, and you can like or you can post your reviews on our IIP India Facebook page. Thanks a lot for this wonderful webinar. Thanks everyone. Thanks all the delegates. Thank you.
Thank you.